Anaesthesia, the ambulatory organiser. If you work in outpatient clinics of any sort, or if you would like to have access to theatre lists for in the future, the use of ambulatory organiser would be very handy. To access your ambulatory organiser, log into EPR and launch PowerChart. It should take you straight to the ambulatory organiser as shown. If you are seeing any other screen to this, you can access this by clicking on the home button in the navigation bar. What you see is the outline of an ambulatory organiser where there are no currently patients or lists selected. In order to select a clinic, you will need to search for the clinician under which the clinic is booked. So for example, where you see patient 4, if you click on that, you can then search for the consultant who the clinic is booked under. So for example, the obstetric pre-op clinic is booked under Dr. Fairfield. I've already searched and found them, but if they're not there, you would search for Fairfield. Once you found them, click on the box and apply. And in doing so, you will now be able to see current clinics and future and past clinic appointments, including the time that the patient was booked, the duration of their slot, as well as the patient details. On here you can see a status column. This has various options. These are usually set by the secretaries, so when a patient arrives and checks in with the secretaries at the front desk, they can update this and you'll be able to see this from your desk. You can also leave a note by clicking on the notes plus icon. So you could leave a note for your fellow clinicians to pick up on, or for yourself, such as if the patient needed specific blood tests and so on. In order to access the patient records from here, you can simply click on the patient's name, which is hyperlinked, and it will take you to their records. Alternatively, right click anywhere along the patient row and you will have links to specific components of that patient record. So you could go directly to their documentation, or you could go directly to the medication list and so on. In order to see future clinics, simply click on the calendar and choose the date of the future clinic, and you will be able to see patients from then. If you would like to use the ambulatory organiser to look at theatre lists, instead of searching for the consultant name, you would search for the theatre number. At UHCW, this will be linked by UH space then M, and then you should be able to see all the different main theatres. So for example, I'm going to choose Theatre 4, apply, there we are. So you can see the patients that are currently booked for Theatre 4 today, and you can see all the details, and exactly the same as previously. You are able to leave notes, access the patient records directly from here and so on. You can view the list for future, click on the calendar, let's say next Tuesday, and there we are. So we have patients for next Tuesday. You can do exactly the same as before. You can have multiple theatres selected if you choose. Simply tick the ones that you would like to see and apply, and you will be able to see them.